Hello again. In this episode of Gas Talk, we're joined by Linda Caccamo, Somnia Anesthesia's COO, who's also an RN turned CRNA, and in the process earned an MS, an MBA, MHA, and a DNP. I might add she's also an accomplished wife and mother, so it's great to have you here today, Linda.
Well, thanks. Thanks very much for having me.
So before we hear about your impressive nursing career journey, I wanted to discuss some insights into nursing that were recently published by Purdue University. They reported that nursing is the nation's largest healthcare profession, which is no surprise to anyone in healthcare. But I also read the ANA's numbers, which show that there are 4 million RNs in the U.S., and that need for them is still growing. So those numbers were supported by the Bureau of Labor Statistics, which is projecting an RN employment rate of 12% growth between 2018 and 2028. So that will be a 10-year expansion that's going to take place at the same time we're having physician shortage that's going to worsen. So as a CRNA and a COO, who is frequently in and around hospitals and surgery centers and surgical offices, what are your thoughts about those statistics?
Well, they're pretty staggering, aren't they? And with the way that the baby boomers are coming in for the aging of the population, more and more of these folks are going to require care. And you know, the profession of nursing is a wonderful profession that I don't think gets the advertisement or the credit that it deserves. Nursing is a grassroots profession that has many different avenues that someone could go into. I can't think of another profession that offers the flexibility and the ability for folks to do what you can do within nursing. Nursing gives you a background, a healthcare background that's a very strong background in order to be able to take care of patients. But it also gives you the business background. It gives you the pharmaceutical backgrounds. It gives you the ability to be able to go into, if you wanted to expand into the administrative or C-suites of the hospitals. So nursing is a very, very robust career that I do not think gets the credit that it needs. And also with all of the education that is being offered now and the development of more and more folks getting doctorally prepared within nursing, one of the things that I think is very important that our healthcare system lacks is that the DNP, which you mentioned that I have, it's a doctorate in nursing practice, that doctorate focuses specifically on evidence-based practice. Teaching the professional to look at the evidence, looking at the care evidence, the outcomes, and being able to really strategize and to be able to look at what is working. So often as a healthcare provider, whether you're a nurse, a physician, a physician's assistant, a lab tech, you go on what's worked well. And always, just because it's worked well doesn't mean it's the best for the patient.
Right.
And some of these things that the DNP, for instance, is offering really does get you to focus on evidence-based practice and being able to communicate that and implement that into best practice.
Okay. That's a sound case for moving on to a DNP for sure. So, you know, in your workday, I'm sure you hear a lot of chatter and lamenting about the continually evolving state of healthcare and how it's disruptive and creating difficult work environments for clinicians. And that's not to mention the confusion it's causing for patients and facilities. There's also no doubt it may be fueling clinician burnout, which is a major topic these days. I'm in a totally different field, but in my work I found that studying market trends helps to navigate change a lot. And so with that said, and given the numbers we just discussed, I was interested in what the team at Purdue identified as trends in nursing for this year and what they thought RNs and, you know, nursing students should be aware of when they're planning their careers. So as a highly qualified and experienced advanced practice nurse yourself, and as a healthcare executive, being the COO that you are, I was hoping you might share your thoughts on some of the trends that Purdue laid out. And the first was increased specialization, which is on the rise. You know, so some nurses might go into psychiatry or gerontology, which we know the demographics are going there, cardiology and obstetrics. And as a specialized nurse in anesthesiology, What do you think are the pros and cons of this specialization direction?
That's a great question. There are many different pros and cons for specialization in the nursing field. But I think that we need to kind of back up a little bit before we start specializing in nursing. We got to look at the different ways that a nurse can enter into the nursing profession. And, to start with, you can go in through a bachelor's of science degree in nursing. You could go in through an associate's degree in nursing, which is usually a 2-year degree, or you could go into the more legacy diploma nurse, which is usually a 3-year diploma degree. And then also they have the opportunity of folks that have bachelor's degrees already that would like to go in and become a nurse and a registered nurse. You can usually get that in an accelerated manner. So, there's many different ways of being able to get into nursing, and folks need to really reflect on what their passions are and really realize, okay, do I really love the bedside nursing, or is it something that I really want to get into the psychiatric arena or the gerontology arena or the anesthesia arena? What do I like most? And I think a pro in that is to be able to extend care. That's no secret. Everybody says that, nurses are great healthcare extenders. But as we grow, as the nursing profession grows, with as I was talking about, being more doctorately prepared, and this is not something that I'm pushing doctorate prepared nurses. I'm not at all. I think it's wonderful.
Right.
But as we grow and learn more on what the evidence-based practice is for us to be able to lead our profession, that will improve care and improve access for our patients overall. But again, I think the key is having great mentors and learning what you like, and then being able to develop a plan. Because a lot of these specialized nursing careers, it's not something that you can do in a very short time period. It can take many years, and I think folks need to be aware of that.
Okay.
Because it's, for anesthesia, for instance, in order to specialize in anesthesia, as a nurse, you have to have at least a year of critical care experience before you can even apply to a nurse anesthesia training program.
Now that would be an ICU or an ER?
ER is usually not accepted. No, it's usually it's intensive care.
Okay.
Medical ICU, surgical ICU, neuro ICU, cardiovascular ICU, specifics to the intensive care units. Some schools may take ER, but some schools do not. So you just have to be aware of that. And then it's a full-time, at least 36-month training program for anesthesia, just to become a nurse anesthetist, and then you sit for the board. So, as I'm saying, you folks really need to research what they like, and then ask their peers, ask their colleagues, ask their mentors, what is it that I need to do in order to be able to reach my goal.
Well, you know what? That sounds like other professions, and I'm glad, because I think going forward, as the patient populations grow in number, we're going to need nurse extenders, care extenders, a lot. So it's great. I'm going to ask you also, I've read that the VA now mandated that all their sites, I think there were 3 in California that didn't allow nurse practitioners to practice independent of physician supervision. Do you have any thoughts about that?
Well, since 2001, different states throughout the country, I believe there are 19 different states right now, have opt-out rules, which allow certified registered nurse anesthetists to practice independently, meaning that they do not need physician supervision. I think that's a good thing.
In rural areas especially.
Of course. But at the same time, we do not need to lose the fact that it's the patient that we are all concerned about, and we have to look at the acuity and the type of hospital settings that we're working in. Mm-hmm. I've worked with the large level 1 trauma centers where you're doing double lung transplants. I certainly want another pair of hands there with me, another anesthesia provider. the anesthesiologist, the other nurse anesthetists. I mean, that is not a place, in my opinion, in my humble opinion, that you would be exercising that ability. However, if you're in the rural hospital setting, that's very much a community-based hospital with very low acuity. And of course, we all know that we get those sick folks that come in, but many times those folks that are really sick can get transferred out if needed.
They're triaged, maybe.
Yes, ma'am.
Yeah.
Yes, ma'am. So, you just need to use your professional judgment. And, and as I said earlier, there's plenty of monitors and studies and equipment that we have at our fingertips right now that really does serve as a huge adjunct and patient safety vehicle for us to make sure that these patients are getting the best quality care that we can get. There's also other avenues that we can use now. We've been very fortunate, with the telehealth that's coming into play. More and more companies are spending more and more dollars on telemedicine, and we're seeing it in anesthesia through what we call a perioperative surgical home, and we're able to see these patients preoperatively through the telehealth capabilities and being able to see them instead of these folks, maybe if they're coming in, from a long way away, we can do it over the computer. We can assess, we can do a lot over that computer.
Right.
And it's a huge asset to us. Another thing that we use it for is the ability, let's say if it's an all CRNA practice, and we have the ability to be able to mobilize in if we need consultative help. So it's a huge opportunity. It's a cutting edge that we're really getting into. And it's something, though, that we really need to work out as far as reimbursement and things of that nature.
Right.
But I do think in the next 5 to 10 years, it's going to be just like the, maybe not just like the pulse oximeter, but it's going to be very, very prevalent throughout our practices.
Interesting. And it's good to hear because it's about wellness. So, Linda, one of the other trends that they listed spoke to the nurse's entrepreneur, setting up her or his own business and providing services directly to patients. For example, nurses as consultants on informatics or quality management, or nurse practitioners or nurse navigators. Do you think this is a positive direction, and will it impact bedside nursing in any way?
Oh, I think it's most definitely a positive direction. And I don't think it will impact bedside nursing other than to promote it and to improve it. Because there are so many things out there right now that can be done to be able to assist the nurse at that bedside. Telemedicine is one. A lot of uses for telemedicine. There's a lot of research that's being done right now on the advantages and the disadvantages and the reimbursement and everything that goes along with a new product for the industry. And even though telemedicine has been around for probably the last decade, it's been around, but it's really just starting to get its legs. And within the last 3 to 4 years, the dollars that are being spent by healthcare systems on augmenting telemedicine are staggering. One of the things within anesthesia that we use telemedicine for is to be able to augment our practices through our perioperative surgical home offerings and being able to offer the patients the ability to be able to get on the computer and be seen by a healthcare professional in order to be able to maximize or optimize their care for their upcoming surgeries. So I do think becoming and giving the nurses the opportunity to be an entrepreneur is nothing but advantageous for our patients, and being able to expand patient care to the areas maybe that other folks aren't able to access care. The only thing I do want to bring forth, though, is some of the issues that are happening from a regulatory standpoint on this issue. We cannot lose sight that in California, for instance, there was a bill that was just recently passed in January of this year, January 2020, that did not exclude nurses from the independent practice statutes. And basically, it states that they cannot function as a 1099. they have to be a W-2 employee. So that does really kind of put a little bit of a hamper on the entrepreneurship for those folks that want to go out and become a nurse practitioner and that are servicing clients and have their own patient lists, but yet they're going to have to be a W-2 employee instead of a 1099. So those are just some of the things that I think that are...
people need to be aware of.
Yes, ma'am. Yes, ma'am. They sure do.
So before we get on to your career path, I just wanted to bring up this looming nursing shortage, which is not a new topic, but it seems to be exacerbated by the fact that there's also a shortage in nurse educators, and that, compounded by the fact that baby boomers are aging and are likely going to stress healthcare in the future. How do you see all these shortages impacting patient care going forward?
That's a big issue because the nurse educators are really training our future. And I think that there's not enough emphasis placed on those folks that wish to go into the academic arena and devote their career in training our future. I know that through the nurse anesthesia environment, there's been a couple schools that are looking at the compensation packages that are being paid to the nurse anesthesia faculty for their schools, and they're realigning and reducing salaries. And unfortunately, that's one of the drawbacks for nurse anesthesia faculty to go into training, because you make a considerable amount less than if you were working clinically. It's probably about 25% less. So I think, what's the answer to that? I think more governmental grants, more education of the public, and more need for potentially federal funding for the schools in order to be able to access more dollars and to be able to attract those folks that are the best and brightest to educate our future.
And that sounds very reasonable to me. So, in closing, before we wrap this up, I was wondering if you could talk a little bit about your career journey, because there could be nursing students and mid-career nurses out there who would like to hear, about how you earned your degrees and what capacities you worked in, the changes you've seen over 30 years now, because you got your nursing degree in the 80s. So there's no doubt that there's been changes since you were in the ICU at Christiana Care Health Services. Perhaps some young nurses and those in mid-career will appreciate hearing your experience as you grew from an RN to a CRNA, then to a DNP, and finally a COO. What were the early days like? And do you want to just share some notes about your career advancements and the drivers that led you to where you are today?
Gosh, that's a 30-year question. It's been a wonderful career. Basically, I started out, as you stated, as a registered nurse at Christiana Care. I worked in their cardiovascular intensive care unit. And I knew as a young nurse that I wanted to do something more. I wasn't sure what. I was looking at being a cardiac perfusionist. I was looking at going into medicine to be a physician. And then one day I had gotten a fresh heart right out of the operating room, and the patient was a little unstable, but one of my favorite anesthesiologists came in and threw this paper on my desk, and he said, "That's what you need to do." And it was a clinical affiliation with the Medical College of Pennsylvania for nurse anesthesia training. And I had just coincidentally had taken my GRE. And so, and I had all of the requirements. So I applied and I was accepted. And that's how my career in nurse anesthesia started. I trained at Christiana Care as a student, and then I went into being a staff nurse anesthetist at Christiana. And then after 2 years, the chief CRNA position became available. And, I had such great mentors along the way, because that one anesthesiologist that I told you about that helped me get into the training program, I had another anesthesiologist that, even though I was a student at this training facility, and we had at the time probably about 70 nurse anesthetists and about 30 physicians.
Large group?
It was for the time. And there was a anesthesiologist that he was the chairman of the department. His name was Dr. Leonard Fagreus. And he gave me the chance to be the chief. And everybody, when I first took it, they're like, she's only 2 years out. She was a student here, and you're going to make her chief of this department. But through their mentorship and through his mentorship and all of the anesthesiologists and the nurse anesthetists that trained me, we all got together and worked as a team. And it was like a big family.
Right.
And that is where I learned so much of the business side of anesthesia. And during that time, I pursued my MBA and MHA, and I got that because, I learned as a nurse, you kind of understood a lot of these things, but when you're sitting in these C-suite meetings and they're talking a lot of financial jargon, and without formal training, it gave you the validity to be able to say, you know what, yes, I do understand that, and this is what we're talking about. I mean, to be able to just more efficiently, and it brought the validity to me in being able to sit in these meetings and be more effective. So then I worked for Christiana for 17 years. We grew that department considerably, and I had a life-changing event, and we had an opportunity of going in to work for a corporate practice side of medicine. And so I did that, and that was a wonderful opportunity. I was there for about 8 years. Excuse me, how time flies. Believe me, I started all this when I was 2. But again, I had the opportunity of being able to go across the United States and being able to look at all different types of practices from Baylor University Medical Center in Dallas, Texas, the big Bumpsy, to the smaller rural hospitals at Missouri Delta in Missouri. Wonderful hospitals, but very different practice settings, very different practice coverage models. And so I had the opportunity of being able to look at the care team model, to the all-physician model, to the all-CRNA model, and any hybrid in between. Also looking at the abilities to be able to use telemedicine for some of these areas. And I was very fortunate to be able to have control centers working in Dallas, being able to use these control centers and how we can actually utilize these different avenues. The company that I was working with was very progressive with that, and it really was quite an education for me. And so also during that time, again, reflecting, I think one of the biggest things that I could say to any young nurse that's out there is always reflect upon you. Reflect upon what, not just what you do well, but what do you need to improve? And if you're honest with yourself, that's the first step to being able to improve yourself. Because, no matter what title you have, no matter what degree you have, if you have the emotional intelligence and you have the ability to be classified as a congruent leader, that's the most important thing. And that's what I would want to be able to be. If someone was asking you or asking me how I would be described, I would hope they would describe me as a congruent leader. Because those are the folks, no matter if you have a title or not, those are the folks that people are going to follow because you lead by example.
Right.
And I think that's some of the things that were taught to me very early on, and I tried to live up to them, sometimes successfully, other times not.
Right.
But I think those are the things that are key in looking at yourself and how you can improve upon yourself. And then this opportunity came up about 2.5 years ago to become the Chief Operating Officer for a national anesthesia company, Somnia, which is a lovely company, by the way, and I don't want to, I'll stop there. But anyway, so I have been with Somnia for about the last 2.5 years, and we're doing some great things here. We're looking to expand practices and just offering some great opportunities to our hospital clients as well as our patients. So that's me in a 30-year time span.
Wow.
Accelerated.
It's very exciting, and I'm sure any nurse anesthetist or nursing student or SRNA would be just but they'd want to talk to you in person, I'm sure. I've no doubt about it. So I thank you so much for being with us today and sharing your thoughts on your profession, on the profession in general, and on discussing your career path with us. So thanks a lot for joining us today.
You're quite welcome. It was my pleasure. Thank you.